Hi there, and welcome to another episode of Health with Dr. Yvette Maseka. This is a podcast that aims to correct myths around health. And today we're talking about breast cancer because it's the month of October and it's the Breast Cancer Awareness Month. As you can see, I'm wearing pink because pink is the color. So I'm joined by Dr. Chibuta, who is who is training to be an interventional radiologist. Welcome.
Thank you very much. I was not well prepared. I should have been in pink.
Yeah. You should be tough enough to wear pink.
Exactly.
Yes, so breast cancer is a huge burden on the healthcare system, globally and including Zambia. So in Zambia, it's third, the first one being cervical cancer. Then we have prostate cancer and breast cancer, which already shows you that it's a huge thing. And one of the misconceptions about breast cancer is that it's for women. Yeah, so men can also get breast cancer, even though, it's like 1 in every 100 cases of breast cancer that we see. Yeah. Let me
True.
see.
That's like 99%.
Yeah, so 99% are females and 1% are males. So, Dr. Chibuta, what is breast cancer?
Okay. We just say cancer,
Yes.
an abnormal growth of cells,
Mm.
which are just the single functional building blocks of your body.
Yes.
So these cells now would take them to the breast. Okay. So the cells which are making up the breast, you find that it's abnormal and it's uncontrolled. So this is breast cancer in simple terms.
Okay. And what are the risk factors for breast cancer? Or maybe before we get to the risk factors, maybe we talk about how someone would present with breast cancer.
Good. That's a very good question because there is misconception that most people with breast cancer, at initial investigation or so, they are going to have a lump. They're going to feel a mass within their breasts. It's not always that sometimes. Then also, when they do present with a lump, majority of the times that lump is not painful. Okay? So this is like one of the major things that we have with people with breast cancer. It's painless. Okay? It's silent. Then other things that are going to be suspicious for breast cancer would be nipple discharge. Okay? Sometimes nipple bleeding, ulceration on the nipple, change in the shape or orientation of the nipple. Okay, so all these factors around the nipple are the ones which are suspicious for breast cancer. Other things as well, you find that maybe there's just reddening of the skin, okay, around the breast. You feel in the side in your armpits, the axilla, you feel like maybe there's some nodes in there, suspicious for breast cancer as well. So there are a number of ways that it can actually present. Sometimes it can be with symptoms, other times without symptoms.
Yeah, and also I saw this woman who came and her breast, like not just like the nipple, like her breast was huge and it was hard. It was like a rock. So yeah, sometimes when like you the breast itself just changes, it becomes bigger or hard.
Exactly. So you notice that if you look at the two breasts, maybe the skin around this other breast has changed. So that's the more reason as women, because it's your body, you're the custodian of everything about your body. We even advocate for a term that we are now calling breast awareness, okay, self-breast awareness. So what just that entails is know how your breasts feel, how they look, okay? So you have an awareness of your breast. You would notice to say, you know what, a few days back, I didn't feel this on my breast, okay? I didn't see this on my breast. You know to say that's alarming for concern for you to be investigated.
Yeah. So the breast awareness is very important. Let me just talk about a few of the techniques that we advise people to do, because of course I'm a lady. So when you're examining yourself as a lady, even a man, actually. So what you do is, if you are trying to check your right breast, you put your right arm behind your head and you massage. I will not massage, but you massage. So you start from the nipple,
Mm-hmm.
then you go round, you feel for anything, and you also feel your armpit. Then if you're examining the left, you put your left arm up and you touch, and you feel your armpit as well. Then you stand in the mirror, you put your hands on your waist. And when you're doing this, you're checking for any dimpling, any depressions, anything, any disorientation of your breast. Yeah, that's suspicious for breast cancer. Yeah.
Excellent. Wow. It's actually good that you you made the description, because I was worried that was going to demonstrate how to do a self breast exam.
Well,
Yeah, but
yeah.
since you've done that, I think that's quite good.
Mm-hmm.
Then also, one important point that you raised there is a dimpling. Okay. So the dimpling, you see, it's sometimes there is no mass in there. Just the dimpling, of course, is going to allow you to go further and notice what is going on with your breast there. So
Mm-hmm.
that's also quite important. Then the other part is in an area like ours, Zambia, where we are resource limited. So when you talk over the screen, which I believe we're going to talk about very soon, we're saying having to do a self breast exam like you have demonstrated, or you got the hospital, what we would term as a clinical breast exam. It's very important because it helps us to pick those things which are we're now going to push further to investigate and diagnose. So what we are saying here is that having to do a breast exam does not self breast exam does not exclude you going to the hospital to be further investigated if there is need
Mm-hmm.
at a particular point, because sometimes you can actually be self cheated if you don't find anything each time that you examine yourself. But we're not saying it's a bad thing, it's actually a good thing. If there is need or for you to be tested, go to the hospital, ensure that you do that.
Yes. All we're saying is that it's sometimes you can easily miss something, or it may not actually be felt.
Exactly.
Yes, and some people have, like dense breasts where it can be hard to actually feel for anything. So
True.
it's important that you come to the hospital so that it's taken a step further. So,
That's very true.
Dr. Chibuta, what are some of the risk factors of breast cancer?
I think we've already talked about the major one, being female.
Oh yeah. Yes,
Yeah,
and
yeah.
that's non-modifiable.
Non-modifiable.
You can't change. Oh,
Yeah.
but they're changing now, so
Well, that doesn't count. Well, you being female, that's an
biological
increased risk.
female.
Yeah, biological female, that's a very high risk for you to develop in a breast cancer.
Mm-hmm.
Then also family history of breast cancer. Also, we're talking about a close relative here. So you can have a mother, sibling, sister with breast cancer. It also increases your risk of having breast cancer. So with the risk in this case, it's always advised that by the age of 25, every woman should have known a risk for breast cancer. If you go to the hospital, your doctor will sit you down, then you're going to have a discussion so that we assess your risk. Is it average or high?
Mm-hmm.
Okay. So if it is a high risk or so, what we do is, instead of you having to be doing mammos at the start of age 40, which is what has been advised for the majority of the population, you will start a bit earlier, which is about 30 years of age.
Mm-hmm.
So then and once we catch it early, it's much easier for us to treat. Okay?
Mm-hmm.
Yeah, that's the number one risk
Wait, before you
factor.
move from that risk factor, Angelina Jolie. Angelina Jolie's mother died of breast cancer, and she was tested for the genetic mutation, the BRCA1 and 2,
Yes.
and she tested positive for both. And they told her she had 87% chance of getting breast cancer. So she had a double mastectomy and had breast implants put.
Oh, wow. That's a very good story. And I think my take home or pick up from that is, she had to assess a risk, okay? And that helped for her to have intervention. Okay, because if she had no idea, okay, yes, of course, the mother had breast cancer, but there are other times that maybe we're not even aware of what our parents or siblings
Yeah,
have,
which
because
is the
that can
case.
directly affect us as well. Because she knew that, she was advised on the right way to go, and I believe with everything else put in place, that was a right decision. So yes, that's actually a good point.
Mm-hmm.
Yes. So, well, like you have said, genetics will play a major role when it comes to risk assessment. So we're just not talking about breast cancer in itself, but also if somebody has a ovarian cancer, it also increases the risk for breast cancer. So in the checking of mutations, actually it's almost basically the same genes which are implicated. So
Yes.
of course, yeah, somebody's going to go out there and be tested.
Mm-hmm.
Then the other risk factor that I would like to talk about is early menarche. Okay, so this one I'll couple it with a late menopause.
Menopause.
Okay, so menarche is just when a woman starts having her periods.
Yeah.
Okay, and menopause is when a woman stops having her periods.
Mm-hmm.
So this is very important because what feeds cancer, the breast cancer itself, is the estrogen hormone.
Mm-hmm.
Okay? Estrogen hormone is the one that is responsible for the secondary sexual characteristics in a woman. We're talking about the breasts themselves.
Mm-hmm.
Okay?
The hips.
Yes, the hips and things like that. Wow, I just had to say that. Okay, yes. So there's prolonged exposure to this estrogen in an individual that has had early menarche and late menopause.
Menopause. Yeah.
So that's the reason it's a much higher risk.
Mm.
Number two, nulliparity. What this means is for people that do not have children, women. Okay?
Now, why are you looking at me?
Well, you don't? Well, I just got to learn that today.
Wow.
All right.
Mm-hmm.
Okay. So, with this, so recall that when a woman is pregnant, that estrogen is more or less reduced in their bodies. Okay. So the exposure that we talked about in our first statement, you find that as a bit reduced.
Yeah. It's like
So
a
the more
pause.
children that somebody has, the more risk is reduced in having breast cancer. So when you have kids, of course, that risk is reduced, so which is also a good thing. Okay.
Mm-hmm.
Yes. The other thing that I'd like to talk about is also radiation therapy to the chest, most times below the age of 25 or 30 years. Okay, so you find that this patient has that maybe a thyroid cancer or tumor. A majority of how we treat our patients as such is that we're going to put them under radiation therapy.
Mm-hmm.
So that therapy can cause mutations, which can also lead to cancer. So that's also one other important aspect to that.
Mm-hmm.
Then the other thing that we'll talk about is breastfeeding. It has been actually shown to say if a woman breastfeeds a child, at least for a good year, it reduces the risk by 7%.
Mm-hmm.
Okay?
Yeah.
And with every child that has been breastfed, even if it's not consecutive, it's going to be reduced by about 4.3%.
Yeah, which
Okay?
is significant.
It's very significant.
And I mean, hormones do have a role to play with that, right?
A significant
Yeah,
one.
because you're
Because,
now producing
yes,
prolactin.
excellent, excellent. Yeah.
Wow. You
Yes.
sound like an examiner.
I mean,
Yeah. Mm-hmm.
then because you talked about hormones, I also like to talk about contraceptives as well. Okay, contraceptions which are higher in estrogen or the combined oral contraceptions as well are going to also increase the risk of you having breast cancer. Okay, yeah. So other things that we can talk about: alcohol always implicated, smoking always implicated. Yeah, so these
Yeah,
are
and
some of the risk
smoking
factors.
is a big thing. Every time
Mm.
I talk about smoking, I always want to talk about nsonko. Because people will come to the hospital, you ask them whether they take tobacco or not, and they'll just say no.
Well, in Sunko, there's tobacco in that. Okay, even the e-cigarettes as well.
Yeah. Well, people out there think the e-cigarettes are safe.
No, they are not safe.
Well,
Yeah.
they do have
Well, they are not safe. It has actually been shown to say they also have an increased risk of everything that is going to do with smoking when it comes to medical conditions, including breast cancer.
so but in comparison to things like shisha, are they safer than shisha, or are they equal to shisha
No, they are
and
not
cigarettes?
safer. Okay.
Uh-huh.
In terms of equality, I will not comment on that because I'm yet to actually equate those things. But to be truthful on this, they are all implicated. To what degree is that information that I'm unable to relay?
Okay.
But they are all implicated.
Yeah. So e-cigarettes are basically vaping.
Yes,
Vaping is a fancy term, but they are called e-cigarettes
true.
because I don't know if it's because you're not lighting them directly, so it seems like they're less harmful. But apparently it's considered less harmful. Some people, I even wonder if they're even breathing any oxygen, because it's just like
All the time. No, it's not safe.
yeah. Okay, that's good to know.
Mm.
So what other risk factors do we have? So we've talked about alcohol, we've talked about smoking. Now this one, remember that there's been this whole talk around men sucking breasts. Now,
Wow.
I don't know if this came from the fact that breastfeeding has shown that it reduces the risk of you getting cancer. And so people say that sucking on the breast will reduce the chances of you getting cancer. I don't know how true that is.
Okay. So, yes, I've actually heard so much about that. I've heard so much about well, men sucking breast and its effect on reducing breast cancer. And well, like any medical practitioner, what we use is evidence-based medicine. So I decided to go out there to look for a journal article that is going to, support that claim. Unfortunately, I couldn't find anything.
Yeah.
Okay. Yeah, but what I can say that was a bit closer to this particular subject is that they might probably palpate a mass and alert you to it.
Yeah. They may feel a mass all sucking. Yes, that's true.
Palpate a mass and alert you to this. So yeah, maybe that can
And
be
say,
the thing.
baby, I didn't feel this earlier. Like,
Yeah. This
what's
awareness
this?
here.
Yeah. Okay.
Yes.
Yeah, I get that. So, let's say someone comes to the hospital, they have a suspicious lump. What do they expect from the hospital?
Okay, that's also a very good point. So this will be dependent on the age of this particular patient. Okay, so for those ones who are below the age of 40, majority of their breasts are going to be dense. Okay, so by dense, you're just saying they're much more thicker. The visibility is not good when you put them on mammogram. So mammo is just a machine that is going to use x-rays to image the breast and also show us if there are any problems with that. Okay, yes. So if somebody is above the age of 40 or a bit advanced, maybe the risk is high, and they are 30, then we can do the mammo just to show us where the problem is. But that also is going to be complemented with an ultrasound. So they'll image you with mammo, then they also take you on the other side and just do a scan of your breast. Then as such, you're now going to categorize where you fall. What's the risk that no, this mass that we have found here is a cancer or it's not. Okay, that's what you would get. Then I would like to give this example. Let's consider the skin. Okay, on the skin you can have a pimple, isn't it?
Yeah.
Right? A mole. You can have a rash there, right? You can even have cancer on the skin.
That's true.
So you having a lump in the breast does not always mean that you have cancer. Okay? Just like the skin, sometimes in the breast we can just have what is known as a cyst. a simple cyst in there. Okay. A lump, that is just maybe a fibroadenoma, what here some fancy term that we have for some conditions. Or it can also be cancer, like on the skin as well. So when you come to a hospital and you have a lump, it's not all the time that you're going to diagnose it with breast cancer.
Yeah.
Okay?
Sometimes it can even be an abscess.
Exactly.
Echipute.
Echipute, yes.
Yeah, that was a very important point to raise.
Yes.
Because someone may just find a lump and think, oh, this is breast cancer, and not think about other possibilities.
No.
Because some lumps are actually normal. When you feel your breast, you feel something there.
Exactly. Sometimes and it's much more common. This thing I'm going to talk about is more common in people that have kids. So you find that the kids who are playing with you, maybe a child is breastfeeding or so, they hit you on the breast. You have a fat necrosis. You have got an injury within the breast itself. So that injury, you just go to the hospital. You have a chat with the people that are seeing you there. Then they will tell you, oh, okay, this one is suspicious for this. It's not significant for us to call it cancer or so. Then we are going to image you again at this particular point in time. Yes.
Sometimes, like for the people breastfeeding, it can just be a collection of milk.
Exactly. So there are those things.
Yeah. But still, we have to tell you that. Don't just stay home and say, oh, this is just an abscess. It's a collection of milk. We are the ones who have to determine whether it's suspicious for cancer or it's not.
Yes.
So when it comes to treatment options, in fact, before we even get to treatment options, we need to talk about the staging of the cancer, which is just a summary of the staging.
It's a summary of staging of cancer.
Staging, yeah, we can just. I know we have the staging that we use, which is the TNM. The tumor, lymph nodes, and
the metastasis.
Yes, but that's more complex because the tumor has its own, values. Then lymph nodes also, the mets as well, which can be confusing because we want to break it down. So we can just talk about stage 1. Anyway, okay, I'll summarize them. So stage 1 is where the size of the tumor is less than 2 centimeters.
Yes.
With no mets, no lymph nodes involved.
Yes.
In stage 2, we have a tumor measuring 2 centimeters to about 5 centimeters. No mets involved as well. Then in stage 3, we have tumor of any size, but at this point, your lymph nodes are involved. The ones in the axilla are the first ones to get affected, of course. Then stage 4 is tumor of any size and you have mets.
Yes.
Yeah.
Okay. That's actually brilliant. It's good. So when it comes to the staging of these cancers, even as you come to the hospital, so what you've actually described is what we call clinical staging. Okay. So there's a clinical staging which is coupled with imaging, where we will do a scan of this patient, we'll do a CT of the patient. So with the CT of the patient, yes, of course, you're going to look at the size of the tumor itself. Okay. We're going to consider if it has gone to the skin. Okay. We're going to consider the lymph nodes, what type of lymph nodes are involved and things like that. Is a chest wall involved? Is a muscle involved? Is it going to the chest and things like that? The bones as well, we need to assess those things. Then there's also the pathological staging, where a sample is taken, it's to the lab, then the lab is going to assess that and stage your tumor as well. So once you get diagnosed with breast cancer, among the things that they are going to ask for is that they are going to now take a meat of that lesion that you have, take it to the lab to confirm whether it is really cancer or not. Like the first thing. Then, of course, the second thing that they are going to do is that they're going to image your body. You enter a CT scan, okay? Image your body to see the extent of all those things. So these are things that you may actually expect. But of course, what's important in this particular discussion is how we can be aware that, breast cancer is real And because you are a woman, even a man, actually, even that 1%, you can get breast cancer.
Yeah, because when
Yeah.
it happens to you, it's not 1%, it's
Exactly.
100%.
When it's you, it's 100%. Thank you so much for that. Yes.
Yeah. So what treatment options do people have?
Okay.
Mm.
So the treatment options, first of all, like with most things, they are going to be individualized. Okay. Individualized in the sense that we are looking at what type of cancer that the patient has. What is it responsive to? There's a thing we call immunohisto, yeah, cytochemistry. Okay. So with this thing, what you are considering is, okay, is this tumor having receptors to estrogen or progesterone and things like that, such that the chemo that you're going to give this particular patient is going to target those receptors. Okay. Then the other thing that we'll consider after we've done all these things is size of the tumor itself. You find that the tumor is small and the like can actually be excised, what we call lumpectomy. So just a lump of it is taken out. Okay. If it's a bit extensive, we'll do maybe like the whole breast. Okay. Yeah.
The
Mastectomy.
mastectomy.
Yes. So there are all these treatment options that are available for you. But of course, you discuss with your doctor if you have a breast cancer. Then also they will share with you the available treatment options.
And interestingly, the world is evolving, and now we're even using the hormone blockers, apart from just using the chemo. Yeah, we're
Yes.
advancing in medicine.
Very, very, very quickly. We need to keep up.
Yeah. So, what are some of the common sites that breast cancer metastases? I hate this word. Where does it go?
Usually, oh, okay.
Metastasis.
Metastasis, okay. Metastasize, yes. No, it's one of those things.
Yeah.
Well, it can go, of course, to the lungs, proximity the lungs. It has got a predilection for the bones as well. So you have to check the lungs and the bones. So these are like the most big things that breast cancer will go to.
Yeah.
Yes,
It's it can spread quite quickly.
very quickly.
Yeah, even going to the brain can literally go
It
anywhere.
it can actually. And actually the beauty about okay, not really the beauty because it's a cancer, of course. Yeah, but what I like to say about breast cancer itself is like unlike other cancers, okay? The progression of it is a bit slower. So when you speak of management and treatment, once we catch it, quickly we intervene. You find that it's much easier for us to, treat it. So
Yeah.
that's the best way we can go about it.
You know how sometimes I think, like when it's initially starting, it starts out slowly, and then when it starts advancing, it's like it's in overdrive and it just starts hitting you everywhere. Yeah, I once had a lady, her her arm was extremely big. It became edema. So, apart from the blood vessels, we have this other system that's called the lymphatic system, which drains the fluid that seeps from the blood. So it takes it back into the blood. So because the tumor was pressing on the lymphatic vessels, so it wasn't draining well. It was huge. And yeah, it was huge. Her lungs were also affected. She couldn't walk because the cancer had gone to her spine. It was quite advanced, and that's how she presented to the hospital.
Oh.
So imagine she was home this whole time.
And because of what you've said, I believe and I think like it's the reason we have days like this, months like this, okay? Purely dedicated to breast cancer awareness, okay? So what we are saying here is like the explanation that you've given, we don't want to see our patients presenting in such advanced stages, okay? It's very preventable. We know how it comes about, we know how to catch it, we know how to actually treat it. So the story that we need to have here is that once we are aware to say that this thing known as breast cancer, we need to go for screening. If you hear conversations as such, you are 25 years of age or even before that, risk assessment. Go to the hospital, assess your risk, then also going to check for you, okay? Then you're also going to be taught, like you demonstrated, how to do yourself a breast exam. So that before all these things can come up, would have caught it early and would have actually been treated.
Yeah, it's very important to get your breast checked. And don't it's not just October when we do breast cancer screening. It's done throughout the year. So any
Throughout it.
day, anytime you feel like there's something wrong, just go to the hospital. I mean, this is a month that's dedicated to breast cancer, yes, but doesn't mean that this is the only time that we screen people.
No.
So you can go to any health facility any day, anytime, and someone will definitely attend to you.
Yes.
Any take home message?
Well, the take-home message, the emphasis really that I have is for my sisters, my mothers out there, the
And
people
your
watching,
brothers.
and my brothers, of course, is that we need to be aware that there's breast cancer out there, number one. And we also need to be aware of our breasts, self-breast awareness, know how your breasts feel, know if there's any developing lump within your breast, ensure that you see your health practitioner much earlier and so that they can actually take care of you. And also know that there's also screening for breast cancer. If you're above the age of 40, you're eligible for yearly mammograms. Okay? Yearly. Every year at least we are screened to check for lesions so that we compare, is this lesion that is developing new or odd, and also we can actually intervene much quickly when you do have that lesion that will be suspicious. And also to take note that not every lesion that you will find in your breast is a cancer. I talked about the skin in my presentation, and also please just also ensure that as well.
Yeah. It's been a very insightful conversation. I hope people out there will check their breasts and come to the hospital whenever they find something that's not usual, that's unusual for their breast. So this has been Health with Dr. Yvette Maseka. Please don't forget to go for breast cancer screening, and don't forget to like and subscribe. Bye.
Bye.